And contract negotiations continue between Sarasota Memorial Hospital and Florida Blue Cross Blue Shield. If an agreement is not reached before the end of the month, it would affect those who are insured by Florida Blue. ABC 7's Rick Adams has more tonight from Sarasota Memorial Hospital.
Well, we have received a lot of calls from folks who are concerned about this. If this doesn't get resolved, it will impact thousands of people. For Sue Ashby and her husband, there is a lot of concern. If a contract renewal agreement isn't reached between Sarasota Memorial Hospital and Blue Cross Blue Shield by March 31st, then the entire healthcare system will be considered out of network.
I'm just feeling a little bit of uncertainty. I'm waiting to have some procedures done, and if they fall after April the 1st, what happens? Where do I go? Do I have to start the whole thing all over again? You know, it's just uncertainty.
Many Florida Blue Cross Blue Shield policyholders recently received a letter from their provider directing its customers to the 6 other hospitals in Sarasota and Manatee counties, just in case this contract can't be resolved. Jack Lugmas is an insurance broker who has concerned clients, most of whom have Blue Cross Blue Shield's coverage.
There really aren't many other alternatives to what Sarasota Memorial can provide, and there certainly are no other alternatives to Florida Blue. So it seems to me that they have to be able to figure out a way to work this out.
The main sticking points with its contract negotiation are over protection from claim denials and disputes and prompt payment for services that have been done. Also, the hospital is asking for a small rate increase for its physicians. In a statement we had received from Sarasota Memorial Hospital, in part it says, insurance contracts are not just about rates and reimbursement, but also important protections for our patients and community health system. While we cannot guarantee that we will reach an agreement tomorrow or even next week, we remain in active discussions with Blue Cross and Blue Shield and are making steady progress each day. We remain optimistic that we can reach a new agreement before the existing one expires on March 31. For Sue Ashby, her husband, and many others, they are hopeful this agreement happens much sooner rather than later.
The patient at the end of the day is the most important person. It's the person that you're going to mend. And you really need to get together, sort out a deal that you're happy with, both of you.
And if you do have any questions or concerns about this, contact information can be found on our website at mysuncoast.com. Reporting from Sarasota, I'm Rick Adams, ABC 7, your Suncoast News.